We're going to talk about COVID-19 and mental health and then go into some things we can do. I'm Mega Shrivastava. I didn't want to have it be a scary thing we start out with, but this is mostly to show the rates of suicide deaths that have happened in New York City specifically. I was trying to find some data on what the rates are in East Harlem and what's the newest data and the trends around mental health and suicide over the past few years since COVID. And there's really not much data out there. 2022 is the most recent data on us seeing suicide rates. And we know anecdotally that rates are getting worse in terms of mental health. But in suicide, it's kind of a mystery right now in New York City, how the rates are. Suicide rates were kind of declining after 2018. And then they started increasing again after 2020 after COVID amongst men and female and amongst all age groups as well. The rates were increasing after 2020. Hopefully they've either stay the same or decrease in terms of suicide rates with some prevention efforts. Mental health is just a big thing that does take a lot of lives of New Yorkers and elsewhere as well. So a huge thing being an important part of our health. And in terms of the COVID-19 pandemic, there's many different ways it's really influenced our mental health. In reality, a lot of life has not been the same since 2020. It's been 5 years, which is kind of crazy to think about. We feel like we're out of the height of the pandemic. It's still around and it's this ongoing thing. We never really got this break after all of that trauma to really recuperate, to feel like things are really all getting better. It's been a really difficult thing to deal with. And so since the COVID-19 pandemic, and especially during that time between 2020 and 2021, rates of anxiety and depression really increased. Substance use disorders really increased. A lot of this was exacerbated or worsened by quarantine initially. And then there was still isolation happening even until now, even though we feel like we're in this post-pandemic era. We're really not. The pandemic's still ongoing in some ways, even though it's gotten a little bit lighter. But for a lot of people that have high health risks, it really has put them into a lot more isolation and has generally made a lot of people worried about health and being more isolated for that reason. And then the grief and trauma around losing loved ones, even debilitating things that happen with your health, some peripheral things that happen with healthcare of missing appointments, not being able to get as good of care during that time. That'll have some repercussions that make things worse later on too. Missing milestones, not being able to see family in that isolation, being with loved ones to cope with grief. A lot of that was really limiting and can have some long-term mental health effects. And then there were increased rates of mental illness, even in months following having a COVID infection. For people that were infected, we've seen that there's increased rates of mental illness following having an infection. And this was worse even if you were in the hospital, which does make sense. A lot of this is really connected with long COVID and people having these ongoing symptoms. Depression and anxiety is also one of the possible symptoms of long COVID. For a lot of these things and with long COVID, because there still is so much we don't fully know physiologically how it can be impacting all these different system parts of your body, it's very possible this is directly from COVID. It's hard to differentiate whether that's from the viral infection that you had versus all of these other factors that contribute to depression, anxiety after COVID infection, which is having other symptoms that's frustrating to deal with after getting COVID, or having to deal with just having to be in the hospital and paying those bills and dealing with being away and that impact. This increased solitude also affected education so much for younger populations, having more remote learning. That's given a lot of younger kids more screen time and disrupted social development and learning development in a lot of ways. This is kind of an unprecedented thing of how other people really learned. So that has really impacted a lot of people. And then younger populations being more on the internet, more remote, having more screen time. A lot of that was influenced by COVID. And then caregivers and frontline workers having to work throughout these rapidly changing conditions has caused a lot of burnout, moral injury, a lot of trauma for people. There was already a higher risk before COVID for disenfranchised neighborhoods, for Black and brown groups. This has just gotten even worse since COVID. A lot of things connect with political things happening too, seeing an increase in racism and feeling even more neglect from these big structures, from our government, from the medical system, seeing that there was a disproportionate amount of people in Black and brown communities that were affected, that had died from COVID, that were not getting as good of care from COVID. These are all things that have made a lot of people feel worse about everything thing and have also contributed to the anxiety and depression and the neglect that they felt from society. There's a higher risk of mental illness among LGBTQIA individuals, especially queer people of color. This was a higher risk that people had prior to COVID as well, but was worsened. A lot of these things that have influenced mental health with COVID are things that existed before COVID, but were just worsened by this terrible experience that we all collectively experienced, but experienced in different ways because it really showed the real problems in our society and the people who are really not catered to enough, not given enough support. And we saw those differences. And that's why there are many very privileged people that feel like COVID is long and gone and we're fine. And they don't know that this is still an ongoing thing and all of the economic, the social influences of COVID, as well as the direct trauma that disproportionately affected Black and Brown communities, that makes it so much harder on those groups. The pandemic is over. Why do we still feel bad? It's really not over, which is a really frustrating thing to hear. It is better. It's a little bit more controlled. We know a lot more, but COVID is still around. This is kind of like the HIV pandemic too. That's still technically not over either. That's still around. These viruses being things we're seeing, and we're behind on still addressing a lot of things around it and giving people the support they need. It's really not as bad as it used to be. That's a really good thing, but it's not over, unfortunately. This is really like prolonged grief for people. Having this like survivor guilt is a big thing too, of people who have lost people. Grief just being this difficult thing and heavy thing that people deal with and often don't have time to really process and to really engage with in mentally healthy ways to kind of cope with. We didn't really get that like coping period. There wasn't really a post-COVID period where we could just spend time in our feelings and with our wellness and all of that. It's been go, 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 dealing with that grief on the go, and then also being there for family members and other people. That has also caused a lot of this ongoing depression and anxiety for many people. And then having chronic stress related to the economic stress that happened during COVID, and then a lot of the financial and housing insecurity that we're still seeing. So a lot of people being affected by all these things. It seems like it's separate from COVID, but it's very related. These are all things that have increased depression and anxiety. There's been worsened inequalities during that time period of seeing the inequalities of like racially and economically of certain areas and neighborhoods getting more resources than others, like get vaccines available to everyone and all of that. But there's still inequalities very much there. And a lot of inequalities have arguably really worsened since that time. And it showed how hierarchical our social system is in this country and worldwide, really. This increase of fascism that we're seeing, and I'm saying increase because it's not completely new. A lot of political stuff is not new in this country of how they find creative ways to oppress and hurt people. But this has been this ongoing thing that people in power, and us being a country where really the rich are in power and make these decisions, that has also worsened inequality even more. And then burnout and fatigue, substance use and overdose. Substance use and overdose has increased so much. It's becoming more of a crisis, but those are all things that have been heavily influenced by the pandemic, the persistent isolation and loneliness, and the continued racism and gaps in accessing care, unfair treatment from the medical system and from larger systems in general. It's really hard in a lot of ways to address mental health because it's this huge thing. There's so many things that are influencing it, but I want to break it apart a little bit, reminding us that there are all these factors. There are so many things that are unfair in our lives and in this country and in this world. And addressing that is not going to be the same for everyone on what's a good way to do it. One of the most important things to remember is to really do something about it. That's not to be like you have to be productive all the time or you have to be doing something for your mental health all the time. It's really just like at one moment in the day to cater to yourself a little bit, to think about yourself for a second and what you need. I'm showing this about what a neurotransmitter is to remind us that even though all of these things feel like it's like your mind, like thinking about these things, there's physiologic chemical reactions in your brain to stress, to happiness, to sadness. These are all chemical interactions that are happening in your brain. So neurotransmitters are essentially these little chemical hormones, you can call them, in your brain that influence our mood, influence how we function, influence how we think, influence how we emote, what our emotions are. When you are sad, when you are upset, it's suppressing some happy emotions and releasing more of like stress emotions, and cortisol isn't on here too, but that cortisol, epinephrine, adrenaline. Those are stress hormones that come out more when you're stressed. And then things like dopamine and serotonin and endorphins, these are things that come out when you're happy. There's medications, there's an SSRI like Lexapro. Those are like serotonin reuptake inhibitors. Those will try to leave serotonin between your nerves so that it can try to increase this happiness. But they've also found, even without medication, doing therapy, the way you think can also rewire yourself to increase the amount of dopamine and serotonin and endorphins in your body. Doing exercises increases these, especially endorphins, increases those hormones. Just remembering that these are chemical things that happen in your brain. Just remembering that like therapy, doing things that are not necessarily like medicine, they are medicine. Food can also increase endorphins and serotonin and dopamine. So you have to be careful with that, making sure you're doing the healthier ones. How do we deal with mental health? We want to normalize talking about it and supporting others by listening and sharing resources. Community building is so huge. Accessing care, which we'll talk about like with hotlines, apps, and clinics, and then practicing wellness. This is an image from the new Happy Co, it's called, on Instagram. I find that even just like looking at these images can sometimes be calming because it reminds me of like of just putting things into perspective and being true to yourself. Just a reminder that when you're true to yourself, you inspire others to be true to yourself too. These are different things that we can do for wellness: meditation, doing some sort of movement, and finding community, building community, engaging in art and music, listening to music, making music yourself in whichever way, engaging with food, getting good sleep, and then spirituality, whether if you are part of a faith group and engaging with that, building community with that can go hand in hand with like meditation or with other ways of having some mindfulness of your body and your spirit and your existence. Those can all be ways to practice some wellness. Using some free apps to help. Headspace and Calm are meditation apps. There's also one called Smiling Mind that I've used. It's a free app and their meditations I've found to be really nice. Mindfulness Coach is another free app. Finch is this like cute app I've actually used recently where it's like this little bird pet that you have. It's set around mental health. It's a little bit of a game while also giving you some mental health goals, and it's free to use as well. And then using the Notes app to like vent and text and write things out, or using paper to do that. And then ChatGPT is another thing that I know there's sometimes a lot of debate on like using ChatGPT, but in terms of like using it for mental health, you can tell it to talk to me like as if you were a behavioral counselor or a therapist, and then text them things. There's like a speaker function now where you can have them read out what their recommendations are. So foods that can like be helpful for your mental health are definitely doing fresh fruits and vegetables, eggs. Dark chocolate is actually something that people have said is really good for mental health. And then leafy greens and meat and seafood. This kind of depends on how much, but doing leaner meats and seafood can be helpful. And then nuts, beans, and seeds. So generally some things that have some protein can be good. And then magnesium in dark chocolate is considered to be potentially helpful. And then doing some deep breathing. So another reminder that this gives you a physiologic response. When you breathe really deeply, it stimulates your vagus nerve to actually activate the calming neurotransmitters. So the parasympathetic nervous system is the opposite of the sympathetic nervous system, which is like fight or flight, where you're like in stress mode. Parasympathetic is like, okay, I'm ready to rest and chill. So it activates that, and it activates calming neurotransmitters in your body. That can really be helpful. There's different ways to breathe. There's box breathing, is like breathing in for 4, holding it for 4, and then breathing out for 4, and then holding the exhale out for 4. Some people do 4, 7, 8, where you breathe in for 4, and then you hold for 7, and then you breathe out for 8. Both are really good ways to calm yourself, however you want to do it. And then diaphragm breathing, like trying to get your belly, doing some belly breathing as well, can stimulate that relaxation. So this can lower your heart rate, lower your blood pressure, and reduce your cortisol levels. And then alternate nostril breathing is a big yoga thing. So it's like basically breathing in through one nostril and covering the other nostril, and then breathing out through the other nostril, and then doing the same thing. And they also say that that can help with some of your congestion feelings in your face. So trying to do something when you're having big emotions or when you're feeling stressed or worried. And even if you're not, getting into the practice of doing something for your wellness, whatever that is, just thinking about something for yourself that you want to do even for a few minutes a day, whether that is meditating, whether that's doing something creative and doing like a little drawing, having a warm bath or shower, that can also be very helpful. Spending more time outside, vitamin vitamin D is a huge thing that often we are very deprived of in New York City. So trying to soak that in, you want to do at least 15 minutes a day in the sun and wearing sunblock. There's a few other emotional regulation strategies that are helpful. Naming the emotion, trying to describe what you're feeling, even if it's in your head to yourself or writing it down, can help you really identify what you are feeling. Because a lot of mental health things can just feel like there's so many things happening all at once and it can feel very overwhelming. So you need to work on sifting this apart. And ideally, you can try to do this with a therapist. Finding a therapist would be like the most helpful, but also yourself just trying to do something proactive for your mental health. It's really horrible that therapy is not more widely and easily available. But if you do call 988, you can get right away counseling if you're feeling really overwhelmed with anything. But then you could also get like referrals and more information for people to talk to more consistently. And they're available 24/7 in both English and Spanish. And you don't need insurance to talk to this number. Finding affordable therapy, there are some clinics through H&H hospitals and then also through Housing Works that you can go through the site. And then talking to your primary care physician, talk to your social worker within the primary care office can often help you find some resources. And just another reminder that COVID-19 is still around. And again, this is like the most recent data is 2022. It's a big part of our health. Reminder about long COVID, there's a lot more information available. And then staying up to date on vaccines. Another thing we didn't talk about is also being engaged with healthcare and up to date on your healthcare needs can really help prevent other things that could really hurt your mental health and also just keep you empowered about your body and your health and getting to a healthy place. This is just another image from this group that I like. We wait for hope, we wait some more, and we're going to keep waiting until we realize we must create it. We're dealt really difficult cards with everything that's been happening with COVID, with life. I know everyone has a lot of stories that they've experienced that really contribute to their mental health, and it's unfair in many ways. We all deserve more from the world and to feel better about how we're feeling and to be able to even just get the resources, like get available therapy, and we're having to navigate and deal with really frustrating things every day. But ultimately, it's really only on our own that we're able to create hope and to be a positive influence. This isn't to say when you do have lows, when you aren't a positive person, you have to give yourself grace for that too. But ultimately, a lot of feeling in your lows, having a little bit of this string and feeling of wanting to get to a better place or not being so destructive.